We are starting this video in the parking lot of Trader Joe's right now. I am out running errands with Ren. We just came from CVS. I got my flu shots. I think we're gonna look at just like some fall stuff. TJ wants pumpkin flavored coffee and we might get some pumpkins. Ren's pretty excited about pumpkins, so yeah.
Okay, we're ready.
I know this video so far has been all over the place. I just got home. I dropped Ren off. I dropped the small bag of groceries off, and now I'm off to my massage appointment. I struggle with chronic TMJ disorder, temporomandibular joint disorder. Once a month or so I will go and get a professional massage. So I'm home now. That was the most relaxing massage ever. I almost fell asleep. It was really nice. It was much needed as well. My kiddos are still napping, so I'm just going to quickly show you what I got from Trader Joe's. I didn't get a lot. I just kind of ran in for a couple specific things and I stuck to that really well. So my husband requested some pumpkin flavored coffee, so I got this, the pumpkin spice coffee. I got these cinnamon whisks. We also have a cinnamon broom at the front of our house. These smell so good. It's like the best part of fall. I saw this at the checkout aisle and I just wanted to try it. So this is called Boo Bark. It is just like a chocolate bar with random decorations, like random candies and stuff on top. I did try it already. It is good. I don't drink coffee anymore. I stopped drinking caffeine like 3 months ago. I got myself this Harvest Blend herbal tea, which is caffeine free. I'm excited to try that out. Last thing I got was some kefir. My kiddos have never really been big milk drinkers. Ren like never drinks milk and Milo will drink it occasionally, but I like to buy this whole milk kefir so that they're still getting some of that fat that they need for their brain development, but they like this stuff. So I always stock up on that every time I go to Trader Joe's. So one of my errands today that I went out to do was to pick up a prescription from CVS, and that was progesterone. So a little bit of backstory. When we were trying for Milo, I was still breastfeeding my first baby, and I had had a chemical pregnancy, like a really early miscarriage a few months prior. So I was a little bit worried about my hormone levels. So I called my OBGYN and I asked for a blood panel to be done, which they did, and it did confirm that ovulation had occurred, but that my progesterone levels were really low. And the nurse practitioner basically said that I had two options. I could just like give up that cycle and try again next cycle, or I could go ahead and start taking progesterone now, like in the off chance that I did get pregnant. And if I was pregnant, I wanted to give that baby every fighting chance that I could. I didn't want to just give up on it just because my progesterone was low. If there was a chance that I could save a possible pregnancy, then I wanted to do it. So I started the progesterone that day, and the following day I took a pregnancy test and it was positive. Very, very, very faintly positive, but it was there. And that baby is now almost 2 years old. Since then, I've had another chemical pregnancy. They're apparently very common. You know, this time around I'm not breastfeeding, and prolactin, which is the hormone that's really prevalent in the body while breastfeeding, it inhibits progesterone. So it's not uncommon for your progesterone to be lower if prolactin is a lot higher. But I'm not breastfeeding anymore, so I'm hoping that that won't be an issue. I don't know. I'm nervous about progesterone levels just because of knowing that Milo wouldn't be here today if I hadn't started taking progesterone. We are gonna be in Florida when we find out if we're pregnant or not, and that means I'm going to be really far away from my OBGYN. I'm gonna I'm not gonna be able to get my blood levels tested, so I called them last week and I asked if they would be able to send in a prescription for me for progesterone for me to take with me to Florida in the event that I find out that I am pregnant in Florida. And the same nurse practitioner, she was a little bit uncomfortable with that because she said, you know, they really do want to test your blood levels to see what they are, to see if you even need it, which I understand, like that makes sense. But I was going to be in Florida, so I wouldn't be able to get my blood levels tested. And it's one of those things where I would just rather be safe than sorry. Like, I don't know, like why not, basically. I mentioned to her about what happened with Milo and she kind of cut me off and said that doesn't mean that it'll happen again, which I know not every pregnancy is the same. I mean, my progesterone was just fine with Ren. I had zero issues with it with her. Prior to getting pregnant with Ren, I had a diagnosis of PCOS, and then I had the low progesterone with Milo, and I've had 2 chemical miscarriages. So just given all of that, I just feel a lot better having that medicine on hand with me. So I went to CVS today. That's what I was getting with Ren. And I got it. I got the medication and it's going to go to Florida with me. On another note, that's still somewhat related as we're talking about like fertility and hormones and all of that. Today is the 21st of September and my period is due today and I have zero signs of it even coming. Normally I'll have like the tiniest little bit of spotting or a migraine or acne, but I've had none of that. I really don't think that I'm pregnant, but I have like a bazillion tests upstairs, so I guess there's no harm in taking one just to see what it says. So if you want, you guys can come with me. This is going to be a really intimate moment. Just kidding. You guys watched me pee on sticks for like a week straight when I was tracking ovulation, so I feel like this is not going to be any weirder than that. And your breath stinks, buddy. Okay. Because I have a zillion of these little cheapy tests, I'm gonna take 2 different brands. I will take the Clinical Guard and the Easy at Home pregnancy test. Like I said, I really doubt this is gonna be positive, but in the very, very tiny chance that it was positive, I would hate to not have it on camera. So I'm just gonna go ahead and take one. 1, 2, 3. Okay, we'll set it right there. I don't wanna look at it right now. I covered them up with the wrapper. Set timer for 3 minutes.
Setting. Okay, 3 minutes and counting.
What do people do when they're waiting for a pregnancy test? Like, what do they do when they're waiting to read it? Like, I'm not nervous at all because I really don't think it's going to be positive. So I need to Google what could cause a later than normal luteal phase. Of course, the first thing that comes to mind is I did not ovulate, or I didn't ovulate when I thought I did. I hear Milo. Hold on, baby. Just wait another 20 seconds. I'll read this pregnancy test and then I'll go get Milo up from his nap. So I'm gonna go ahead and look. It's been 3 minutes. Oh. That is like super negative. There's definitely no line there. I'll check the other one. No. And at this point, like, if today was supposed to be the date of my missed period, then this shouldn't even be like a squinter. It's, by the time you miss your period, you should have like a very solid, definite line. And these are 2 very negative tests. So there you go. Not pregnant, not surprised. Just have to wait for my period to show up. Do you want to help mommy clean this room?
Sure.
It's pretty messy in here.
Okay, you're messy.
Yeah, but you're such a big helper. I think real quick I'm going to clean up our room. What are you playing with, bud? Who needs toys when you can have curling irons and blow dryers, right? Yeah. You'll need some more hair on your head before you have enough to curl, buddy. That's our Saturday. Super exciting. But I hope you guys are having a great weekend so far. Or if it's not the weekend anymore when you see this, I hope you're having a great day. Don't forget to hit like and subscribe, and I will talk to you guys soon. Bye.